Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead.
Thank you, Christine. Good afternoon, everyone. Today, I'm happy to report that there are no new cases of COVID-19 for the 9th day in a row. You've all worked hard to get us to this point, and Dr. Strang and I are very grateful. It's good news, but we can't become complacent. COVID is a reality, and we are going to have to learn to live with it. Practicing good hand hygiene, keeping your distance, staying at home if you feel sick, these things have become part of our daily routine. And as we prepare to open up our province even further, we must continue to be vigilant to minimize the impact of a second wave of COVID-19. So today we are announcing that non-medical masks will become mandatory in indoor places effective July 31st. Dr. Strang will give you more details, but we all need to be open to wearing a non-medical mask in most indoor public places. This is how we can protect each other and support our local businesses as we learn to live with COVID-19. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Since the last briefing that we were here last Friday, we have announced no new cases of COVID-19. And again, today we have no cases. So we remain having one active case of COVID-19 in our province. For those who are count the numbers, to date we've had 1,067 cases of COVID-19 in total. We've had 61,626 Nova Scotians who have been tested, and the results have been negative, and we've unfortunately had 63 deaths. There are no licensed long-term care homes in Nova Scotia with active cases of COVID-19. As our province reopens and we learn to live with COVID-19 in our lives for the short to medium term, it remains vitally important for anyone who has symptoms of COVID-19 to seek out testing. It's key to containing the virus and knowing where it exists that anyone who might have COVID-19 get tested so we can isolate them if they're positive and work with their contacts to quarantine and test them as well. I know there's been a number of questions from the media throughout this week seeking updates on the last new case that we announced on July 15th. When this case was announced, the source of infection for that individual was not clear, and since then, public health has been investigating any potential to understand contacts and where this person may have themselves gotten infected, and that's what we do with every single case. While a very small number of close contacts have been identified for this case, the source of the infection of the case has not yet been determined, and the investigation on this case is ongoing. The fact is, however, as we saw during our first wave, that for some cases, the source of infection may never be determined. This shows why it's important for people to continue to follow the basic preventive measures. Even though we're at a low risk now, it's not zero risk. So we need to continue to understand that we are living with COVID for now and for as I said, for a number of months, if not years to come. So it's important that we all follow the basic preventive measures. Those are the tools we have to control COVID. Yesterday, the QE2 Health Sciences Microbiology Lab processed 677 tests, and the fact that that even though we're testing, we tested that number yesterday, we're seeing very few cases, and all but one in the last few weeks has been related to travel. That's good news, but it doesn't mean that we can be complacent. We have to remain vigilant. We have a lot of people moving around our province and coming in out of the province, necessarily so. COVID remains a global issue, and we can't expect that Nova Scotia is not going to be part of the ongoing pandemic. So once again, I'm going to talk about move forward around mandatory masks like we talked about last week. I want to thank Nova Scotians who remain mindful of the public health measures that we all need to do to prevent the spread of COVID-19. We are proving that we're capable of adapting to our new normal. And on that, I just want to make a little side note that around lining up in stores. I got a very nice letter from an elderly gentleman the other day, and he asked me to remind Nova Scotians that there are some elderly people and people with disabilities who can't stand for long periods of time. And so as part of our compassion and caring for one another, we need to have, when we create lineups because of physical distancing, we need to have seating accommodations. And also, as individuals, it'd be nice that we could just say to these people to go to the head of the line, because if we have the capacity to stand and they don't, it's the kind thing to do. So thank you to that gentleman for writing me, and I hope people take note of his request. I'm noticing that more people are adapting to wearing non-medical masks, which is great. As I've said before, the evidence on non-medical masks has evolved throughout the pandemic, and our public health direction has evolved along with it. As a result of that, last week we announced that non-medical masks would be mandatory on public transit and transportation, and that law came into effect today. Last week I said that was the first step, and today we are taking the next step. So as the Premier said, effective July 31st, non-medical masks will be mandatory in most indoor public places in Nova Scotia. We're doing this because we know that along with all the other public health measures, non-medical masks are effective in helping prevent the spread of COVID-19. As I've said many times, that package of public health measures, which include masks where appropriate, are the tools we have, and if we all do them well, they can have a substantive impact in protecting us. Before the second wave of COVID arrives, and in all likelihood it is coming sometime in the fall, so we need to be prepared, and part of that preparedness is making mask wearing much more of a habit, making it the norm for all Nova Scotians. So let me unpack the details of what we mean by indoor public places where non-medical masks will be mandatory. Indoor public places are locations, either privately or publicly owned, where the general public has full access. So for purposes of the mandatory mask policy, this includes indoor retail businesses, personal service establishments such as hair and nail salons, spas, body art facilities, shopping centers and malls, places of worship or faith gatherings, places for events like conferences or receptions, and train or bus stations, ferry terminals, and airports. It includes public places where food is served, places like restaurants or licensed establishments, a food court at a shopping mall or a food store, concessions at a movie theater, or any location where food or beverages are being served. You can take off your mask for eating and drinking, but when you, for instance, in a restaurant, when you're entering the restaurant, waiting to be seated, going to the washroom, or getting ready to leave, you will be wearing your mask. On the topic of restaurants and licensed establishments, I want to note that effective today, we are making them safer by requiring that people remain seated when they're at a restaurant or licensed establishment, except while entering and exiting or going to the washroom. Having people out of their seats, moving around, mingling, increases a significant level of risk. We're seeing that in other jurisdictions, even in Canada. So we're taking the step to make our restaurants, licensed establishments as even safer. All these safety steps are what we need to do to maximize the ability to let these businesses function and people to go to them, but keep them as a safe environment. Indoor public places also include places for cultural or entertainment services or activities, things like movie theaters, the symphony, a concert, or any other live theater performance. They also include places for sport and recreation like gyms, yoga studios, indoor tennis facilities, with the exception that when people are actually doing a physical or other type of activity where a mask cannot be worn, then they can take the mask off. So for instance, if you're going to work out at a gym, you need to wear the mask when you enter the gym, when you're in the change room, but when you're actually working out, then you can remove the mask. And while I'm on the subject of sports, it's my pleasure to note that we have a solution that will allow baseball and softball games to resume. This solution is going to allow incidental, very limited and time-limited direct contact between athletes. This has implications for some other medium contact sports as well. So Sport Nova Scotia will be reaching out to these sport organizations and all the sport organizations that are impacted early next week, and there'll be more information to share once that communication to those stakeholder groups is done. So back to the list of public places. It also includes the common areas of a tourist accommodation, for example, a hotel lobby, hallways, or the elevator. However, it does not include those same type of common areas of the lobby, the elevators, in an apartment or a condo building, because those are considered private spaces. It does include public areas of a university or college campus, such as a library, or common areas of a faculty building or student union building. It does not include classrooms, labs, offices, or the residences. Our mandatory mask policy does include common areas in an office building, such as the lobby, reception area, or elevator. But once you step inside a private business in that office building, the mask requirement does not apply. And I'll use the example, my dentist is in Sunnyside Mall in Bedford. So under this, when I go to the dentist next, when I'm in the mall, in the elevator, and in the lobby area, up on the 4th floor, when I go to the dentist, I need to wear a mask. Once I enter that dental space, I don't have to wear a mask. I will, but also the dentist office has the ability to create their own policy for that private area. But once you're into a private office space, it's up to the operator of that private office space. Many of the private businesses have already chosen to put mask policies in place, and we encourage others to take the same step and require the use of masks by their staff and clients and customers. Our policy also includes municipal or government offices, or government locations that offer services to the public. So, for example, Access Nova Scotia locations will require staff who serve the public as well as the clients to wear masks. Municipal and provincial departments can set their own policies for mask use in other parts of these offices. So, for example, my department, the Department of Health and Wellness, has adopted a policy that staff and any visitors to the office will need to wear masks when in the common spaces within our office building. Masks will not be required in a courtroom, but will be required in common areas outside the actual courtroom, and that was a decision made by the court services, and that's in relation to the need to appropriate functioning of the actual courtroom, but the common areas that are associated with the courtroom will require masks. There are a couple of exceptions that are allowed. So a business or a government official can ask you to remove your mask for identification purposes. The commonest one is getting your picture taken for your driver's license. And of course, you will be allowed to remove your mask for a short period of time for that purpose. Masks will also be allowed to be temporarily removed for ceremonial reasons, such as the taking of communion or a bride or groom during their marriage ceremony or wedding photos. If you're getting a personal service or treatment that requires moving your mask, such as a beard trim or some kind of a facial treatment, you can remove the mask, but you must then put it back on as soon as that service or treatment is done. And this has already been addressed in the reopening plans for a barber and the cosmetology sectors. This policy does not change anything in the back-to-school plan that we announced on Wednesday. Schools, daycares, and day camps will continue to follow their existing reopening plans. As we have done with public transportation, we said last Friday, we said children under 2 are exempt. But as we've thought about this and looked at some other jurisdictions, today we're adding for public transportation and as part of moving forward with public buildings, that in situations where children that are 2 to 4 and their parent or caregiver cannot get them to wear a mask, those of your parents, I remember being there with my kids. There are occasions when it's challenging behaviors. So in those situations, we say it's okay that for that period of time, time in that specific event that the child not be required to wear a mask. The last thing we want to do is have a mother be forced to leave a bus because their child is having a hard time and can't put on a mask at that time. We also know that people with valid medical reasons for not wearing a mask are exempt. But as I mentioned last week, there are very few valid medical reasons to not wear a mask, and they're mainly related to anxiety. The Canadian Thoracic Society states that there is no evidence that wearing a mask worsens a chronic lung condition such as asthma or chronic obstructive lung disease. I do recognize that for some people with chronic breathing conditions, wearing a mask can create anxiety. There are also people with mental health conditions for whom wearing a mask that can create anxiety or exacerbate an existing anxiety disorder. However, for many people, there are ways to overcome anxiety, such as practicing wearing a mask for short periods of time at a very safe space, such as at home. But we recognize that there are some people with valid medical reasons. There are also individuals with cognitive or developmental disabilities that are unable to wear a mask, but the vast majority of us are able to wear masks. So as I said last week, please don't go looking for a reason to not wear a mask. We will not be asking for medical certificates, so don't go to your doctor's office looking for one. We're not going down a road of requiring medical certification. Our line is, please don't ask, just wear a mask. We recognize that this is a significant step for everybody. We ask all Nova Scotians who are capable of acquiring their own masks to do so. Many of you already have. But having said that, we are looking at ways to ensure masks are available for anyone who may have difficulty getting one. So we've already started work with the transportation sector of distributing some of the government supply of non-medical masks, and we're looking at needs in other sectors as well. We're also working on resources to help owners of the affected public places to communicate that masks are mandatory in their spaces. So, for instance, common signage that could be used in any location, the same message and the same look and feel, if you will, across the province. So we're taking a cooperative and positive approach to mandatory masking rather than an enforcement approach. But I believe and I have confidence that the vast majority of Nova Scotians will do the right thing and will wear a mask when it's required. People should also be aware that businesses have the right themselves to refuse entry or to refuse service to people who are not wearing a mask when they're required to, but always with the allowances for the small number of people with valid reasons for not wearing a mask. So as I said earlier, and I've said many times before sitting here, that wearing a mask along with all the other core public health measures is how we will minimize the impact of a second wave of COVID-19. It is our best chance to keep our communities and the economy as open as possible as we move into the fall and a possible second wave. Non-medical masks reduce your risk of COVID-19, but most importantly, they substantially reduce the risk of you passing your infection on to somebody else. So if everyone who can wear a medical mask in indoor public places and public transportation does so, we will keep each other safe. It's about caring for each other, creating a positive community, and using common sense. So let's all make wearing a mask a habit. When you grab your keys to leave home, grab your mask as well. I know there's a long list of places to remember, but all you really have to remember is this: when in doubt, wear a mask. Premier.
Thank you, Dr. Strang, and we'll be happy now to answer any questions you may have.
Reminder, one question and one follow-up in the time that we have allotted for today for reporters on the line. First question goes to CTV's Nick Moore.
Thank you very much. My question is for the Premier. There's been plenty of people voicing disappointment and anger that there will only be a review of the April tragedy and not a public inquiry. Because of this cloud, I'm just wondering, people making those calls, they're saying, does that matter to you that there is this cloud over it? And if it does matter, how are you going to address it?
Well, certainly, obviously, we're concerned when people are expressing a lack of confidence in the review panel. What I can tell you And I understand, quite frankly, why people have lack of confidence in government. It's not, I don't take it personally. I don't take it as a partisan issue. I think there's this across the globe, people are having uncertainty about how they feel about their governments. What I would say to Nova Scotians, I have been forthright and upfront with you, not only for the last 4 months, but quite frankly, for the last 7 years that I've had the privilege to be the Premier of this province. And whenever there's been difficult times, I've tried to stand in front of you and be honest and open about getting you the answers that you require. This review is led by 3 prominent Canadians, all of whom either have a background in the law or in law enforcement. They have been mandated in this committee to find out many of the answers that family members have been looking for, like RCP response and law enforcement response the night of that incident, the communication response by RCMP in the province, whether or not there was a relationship between the perpetrator and law enforcement, whether there's gender-based violence associated with what happened there, how could anyone have the amount of illegal arms associated with it. And these 3 prominent Canadians believe that the mandate they've been given will allow them to achieve the answers to those and the outcomes that Canadians are looking for in a timely manner. And I think that's important. But I can tell you that at any point, if those 3 panel members believe they require more power from our province, they need to ask. And we will respond and work with them to ensure that we get to the bottom and deliver on the answers. And I think it's also important that family members themselves, not representatives looking out for family members themselves will have access and be able to be part of this. And that was a critical component for us. So I want to reassure all of those in this province who've been impacted by those 2 days or, quite frankly, have been feeling the pain and suffering that those families have been feeling. We as a government are doing everything we possibly can to get to the bottom of those answers, and we'll support these 3 prominent Canadians who have the ability to ensure that they get to those answers.
Nick, go ahead with your follow-up.
Thank you. I'll move on to COVID. What is the status of the discussions happening about the Atlantic bubble opening up to travelers from all across Canada?
That's been ongoing. That's not been decided. We've not landed on what is a uniform date at this point. I can tell you we are going to have to, as a region, begin to opening up to the rest of Canada for the economic health, quite frankly, of our respective provinces. That does not mean we'll be opening up to international travel of any kind, but it means that we'll be allowing Canadians to move across our country, as all of us, quite frankly, today have the right to do in every other part of Canada. We can fly from here now to British Columbia without self-isolating. We can fly from here to Ontario or Quebec. I'm very proud of the work that we've been able to do. I'm very proud of the work that public health has been doing. But we are going to have to learn to live with COVID. And we are going to have to recognize that we need to begin to open up our economy even more because the economic health of some of our families has been devastated. We've shut them down for over 4 months. We're in the middle of a tourism season. Quite frankly, 2 of the most lucrative months of their businesses have been shut down. As we continue to see these positive signs in the region, it is my view that we are going to have to look at how do we open up to the rest of Canada. I know this is not going to be universally accepted. I know that not everyone's going to be happy about that. But we need to, as we have at every point in this journey, been upfront, direct with Nova Scotians about the decisions we're going to make and why we're going to make them, and we will do so in this one as well.
Next question will go to CBC's Yvonne Colbert.
Premier, on June 4th, you were asked about an inquiry into the April mass murders. At the time, you said you had made it very clear to Ottawa what you were looking for, and you said, quote, the process needs to be able to compel witnesses to come forward, and it needs to have binding recommendations. The review your government announced yesterday does neither. So how can you support a review which doesn't do what you said needed to be done just last month?
So this is a joint review between both the province and the federal government. As you know, we have an inquiry going on in our province to this day, right now, the Desmond inquiry. We cannot compel federal witnesses. We cannot compel the federal government to implement any recommendations that are coming from that inquiry, even though we're dealing with Canadian Armed Forces and other federal agencies. This review that we're doing now on those terrible days in April in our province provides an opportunity for these three distinguished Canadians, all of whom have a connection to the law enforcement or, quite frankly, the judicial system. Chief Justice McDonald will chair this. They believe what's been provided to them will allow them to get to those critical answers that those families want. And I made it very clear, if they are at a point where they need more power or they need more support to be able to get to those answers, they need to come to our government and we'll respond to them. But I only have the jurisdiction over those institutions that are provincial in nature. Right now, we have all the federal agencies at the table, along with provincial agencies. And we have entrusted in Chief Justice McDonald and the other two panelists to be able to get to the answers that Canadians want, that Nova Scotians want, and most importantly, quite frankly, those families want.
Yvonne, go ahead with your follow-up.
Some of the families of those killed have called this review a slap in the face and far from transparent, because there's no requirement for public hearings or for the information that is gathered behind closed doors to be made public. What do you say to the families who want an open public review and are inquiry and are not happy with this review?
So I would say to them, first of all, Yvonne, I don't know that I could ever understand the pain that those families are going through, nor could any other Nova Scotian. This has been a devastating period of time. People going about their lives, and then this perpetrator decides to have 2 days of violence on our communities in a picturesque part of our province that this would be foreign to. So what I'm trying to say to these families is we're working to achieve the outcomes and the answers that I believe are most important, and they believe the ones that they have brought to us. Is the relationship between this perpetrator and the RCMP? That is mandated in the terms of reference. What was the response that night by law enforcement? What role did the communications play in terms of whether it was RCMP communications or that from the province of Nova Scotia when it came to putting the alert out? These are all mandated in this. What did gender-based violence have a role to play? These are mandated into this terms of reference that our panelists believe they can find those answers out for these families and for Canadians. I understand, quite honestly, that there's a level of there's a belief out there that the only way to get to the truth is to a public inquiry. Well, that's just not true. And we know that not to be true. We all know that, including those who are asking me these questions. The reality is we all know right currently today we have a public inquiry going on in this province that the federal government is not sitting at the table. We want them at the table. They need to hear directly from and they need to be part of the solutions that we come with so we can answer these questions for these families. And the recommendations that come out will come to each of our governments. And it'll be incumbent on all levels of government to be able to respond to these things in a positive way to implement the changes that are coming forward. I want to know, how do we end up with 3 illegal firearms, according to the media, in our province? How do we end up with a marked police car that everyone seemed to know about being able to travel the roads of our province? What was the relationship between this perpetrator? How often did he become connected with law enforcement? These are things that we will find out through this inquiry, through this review that the panel will be doing. And I've made it very clear that if these panel members, all of whom have led distinguished careers in law enforcement and the judiciary, if they require more support from our government and more authority to be able to achieve those answers, if there's a witness who decides they're not going to come and sit before this panel, we will give them the authority to achieve that. But let's do it in a way that's in a timely manner that also gives these families a voice. Not just sitting in the background while someone else speaks on their behalf. Let's give them a chance to have a voice with these panelists.
Next question will go to Global's Jeremy Keefe.
Thank you. About the mandatory mask use, what I'm wondering is how will this be enforced? I believe I heard, that maybe it won't be. So I'm wondering, how is this going to be enforced? And if it isn't going to be enforced, like we had heard, there wouldn't be any policing of it on transit. Do you not anticipate this being an issue that will cause some animosity between some members of the public if government, if police aren't taking this on and handling this as a mandatory measure?
So I don't think we ever want to get in a position where we're having a strong kind of enforcement policing presence in an area like this. I firmly believe that the vast majority of Nova Scotians will, if they really understand, and I believe they do. We've already seen in the last few weeks a significant increase in masks, but we got a lot more space to improve. I firmly believe that most Nova Scotians will do the right thing and take steps that will protect them, but more importantly, protect their fellow Nova Scotians. Are there going to be some people who don't? But that happens in basically everything we do. I think we need to come at this from a positive, constructive approach, work to support people, and one of the ways we're doing that is taking some steps, as I outlined, to make sure that their access to masks is not an issue, is not a reason why someone can't wear a mask. The other piece is that if people see somebody who's not wearing a mask, don't make a judgment. You don't know what that person's medical history is. You don't know, maybe they have a disorder that they can't wear a mask, so don't make a judgment. We need to all support each other in a positive way. And I really believe if we follow that approach, that is how we're going to get people to cooperate with each other. Taking a strong, heavy-handed enforcement approach is not going to work in something like this.
Jeremy, go ahead with your follow-up.
What I'm wondering, and this would be another question for Dr. Strang, is today we're making masks mandatory in public spaces. It wasn't that long ago that we had far more cases, and you were hesitant to make it mandatory that workers and anyone in long-term care facilities would be mandated to wear masks. I'm wondering if you can tell us where exactly the data has come from since then, when we were in a worse situation and you didn't make it mandatory for people to wear masks in long-term care, to now when we have one single case in the province and it's now mandatory to be wearing masks in almost any situation.
So the science on masks has definitely evolved on the evidence of the effectiveness of masks. And if you remember, it was late March, early April where we were starting to change and say we now have some evidence of the importance of wearing masks. And we very quickly then moved, like other provinces, within about a week of that newer evidence coming forward, where we brought forward a policy that required healthcare workers in long-term care facilities to wear a mask, and we provided masks into all those long-term care facilities. So I don't think we were slow in moving on with the evidence. So in any event like this, the evidence evolves, and you have to adjust your response and your policy approach as that evidence evolves. And we have done that, and we'll continue to do that around masks. Even though their epidemiology is low right now, the reason we're moving now on the mandatory masks is to be out front of the likelihood of a stronger way of a recurrence of COVID in the fall. It would be wrong to, the evidence we know about masks now, I believe it would be wrong to wait and then bring in a mandatory policy of masks when we, in the midst of having that recurrence. Because we know it's going to take time for people to adjust to this. We have to, put the things like getting signs in place, distributing masks, changing people's behavior, changing a social norm doesn't happen overnight. So that's key that we start to do this now. And so, when we get a resurgence in the fall, in all likelihood, that we have a much more of a norm around masks in place. And the reality is we know how this virus is spread. It's in closed places where there's crowds of people and close contact. We also know in those high-risk places, if people are wearing masks, it has a great reduction in the transmission of the virus. So the time to institute a policy is actually now, because if we get high uptake on masks and people adhering to the mandatory use and the indoor spaces, these indoor public places are the high-risk environments, one of the key ways we minimize that recurrence and our resurgence of COVID-19 is through wearing masks in these high-risk places.
Next question will go to Michael Tutton with the Canadian Press.
Good afternoon, Premier. Just to follow up on Yvonne's question, are you saying that the federal government would not agree to a format for the review for a public inquiry where it would have its officials in a public hearing and compelled to testify under, and able to be compelled to testify under oath, but that's what but the government of Nova Scotia was willing to do that. The Ottawa was not. Is that what you're saying?
We currently have an inquiry going on in our province today where that is the fact. That often gets missed when people believe that the only way to get to the solution is through an inquiry. What we have before us is a process that three distinguished Canadians who are independent of government, who fully understand the law, both from a legal point of view and policing point of view, that will have the mandate and believe they have inside of their mandate the ability to answer all those questions that will go across all jurisdictions, both provincially and federally, and quite frankly, looking at Canadian Border Services, which is bringing illegal weapons into our province to answer the questions that families will have on that night. They have clearly said they believe that it's before them. What I have said, though, if they believe they need more power as they continue to develop and continue to go through this process, we as a government would be willing to listen to them, and we can react to the issues that pertain and that we have the ability to do, which is those that fall under provincial jurisdiction.
Michael, go ahead with your follow-up.
Just a question for Dr. Strang about a particular aspect of the mask world. There's people that sometimes stand at the front of a group, the ministers, speakers, concert performers. Now, will they have to wear a mask when they're addressing the group that they're all masked in their congregation or their assembly? How will that work?
So they will, as they're part of the people in that environment, and so the way we create the safest way we create the greatest level of safety in those environments is have everybody wearing a mask. I've talked to some singing groups in part of my consultations. They have told me that they practiced rehearsals, etc., with masks, and they're able to do that effectively. So it may require a different kind of miking or something like that to help project, but it's important that we have masks in these kind of situations.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Hi, thank you. For the Premier, regarding the public review and the timing of yesterday's announcement, why did it take 3 months to come to a conclusion about the process to review this strategy, especially given that now the process is a review which Ministers Fury and Blair and you have said is about timeliness?
As you know, Minister Fury, our Minister of Justice, was working with the national government to ensure that we could get all the players to the table, all of the appropriate agencies that would be required to get to the table. I think both of them said yesterday at the same time there was an active investigation going on. So it took time there. We needed to make sure that when they decided on the process, who the panelists would be, level of expertise required, took time for them to achieve that. So after all of that, the announcement was made yesterday.
Go ahead with your follow-up, Lindsay.
Thank you for that. We've heard from families that are most affected by the tragedy who are disappointed with the view, as we've said today, specifically the language surrounding trauma-informed approach of this review, because they feel they're being excluded under the guise of trauma-informed approach and they want the participation of a public inquiry. Why should these people feel confident in this review, given that it's not the public inquiry they asked for?
Well, the term that you refer to, trauma-informed, would be, for example, in a restorative process, people may not want to participate in that. They may want, as the panelists may determine the best way to not do harm would be to have certain things that would happen in public and certain things that may not. That's the flexibility that we're providing to the panelists. Bearing in mind, there are 22 family experiences here, all of which are feeling and experiencing a similar thing and yet different. Some are more open and want to be more public, others don't. We're trying to find the place that gets them the answers that they need, the answers that, quite frankly, all of us want. And we believe these three panelists will be able to do that. We believe we've given them the tools. They feel we've given them the tools to be able to achieve the outcome. But as I said earlier, if that is seen that is not the case, if somebody determines they're not going to participate and the panelists need more authority to do that, then we will certainly look at that from the ones that pertain to the province, and then the federal government would have to determine on the ones that would pertain to them.
Next question will go to Cassandra Nadeau-Lamarche with Radio Canada.
Merci. This is for to Strang. So if there's no enforcement of the mask policy, as we've seen from many protests around Canada and the U.S. that have people that do not agree with these policies, what's going to happen if you notice that people are not following your instructions? Is enforcement something that could be done if that happens?
So I think that's a very small minority. I saw just a couple of days ago there was a national opinion poll that said about 80% of Canadians support mandatory masks. We had an anti-masking protest on the waterfront last week that had 12 people show up. So I don't believe that there's a large number of people who are vehemently opposed to this. And so I come back to I firmly believe that the vast majority of Nova Scotians are going to do the right thing, that we care about each other, that we recognize that it's not a big imposition for the relatively small period of time. You go to a restaurant, you go to the mall, you put on a mask to keep each other safe.
Go ahead with your follow-up, Cassandra.
This is for Dr. Strang again. Why have you decided to once again extend the state of emergency, and what conditions are going to be needed to end it?
So that would be, Dr. Strang would do the public health order. We as the Executive Council would extend the state of emergency. There's provisions in that, for example, commercial rent cannot be evicted. There's other aspects of that that allow us to continue to monitor the impact of COVID on our economy and how we deal with it. And it'll be in place for the foreseeable future. You're seeing it across the country in respective provinces. But when we certainly feel comfortable that it's time to lift it, we will certainly communicate that to Nova Scotians.
Next question will go to...
I apologize for this, Chrissy. And it has to be, because of the provision, it has to be renewed every 2 weeks. It sounds like that, but it can only be implemented on 2-week periods. So every 2 weeks, it has to be renewed by the Executive Council, and that's what's happened for the last 4 months.
Next question will go to Nabal Snan with the Herald.
Good afternoon. This question is for Dr. Strang. So there was a survey published on Wednesday that said about 3/4 of Canadians would likely get the COVID vaccine when it's available. And I was wondering, how does public health here in Nova Scotia plan to address any concerns that people may have about any COVID-19 vaccine?
So we haven't even turned our attention to the vaccination. Having a vaccine is well down the road, despite there are some very early positive signs from clinical trials, but there's a long way to go between that and having a vaccine that is known to be effective and can be mass-produced and then delivered to large numbers of people. So we'll deal with the communication aspects and how we roll a vaccination program out and help people understand any of the benefits and potential risks when we get to that point, but that's well down the road.
Nabal, do you have a follow-up?
Thank you. As part of the response to the COVID-19 pandemic, from my understanding, is that long-term care home residents were kept out of hospitals to free hospital beds. So what's the policy now around sending these residents to the hospitals for treatment?
So there's nothing that would stop if a long-term care resident needs to go to hospital for whatever condition. They're able to do that. We continue to work, and then how we get those individuals back to their whether it's into their home in a community or to a long-term care facility once they no longer need that acute care bed. But there's no barriers to that kind of care at this point.
Next question will go to Lois Ann Dort with the Guysborough Journal.
Hello, this question is for Dr. Strang. St. FX has an approximate full-time student body of 4,000, and the university has stated on its website that 50% of the student body comes from outside of Atlantic Canada. Given that there are currently spikes of COVID-19 in other provinces, are you not concerned that St. FX is planning to have mostly in-person classes in September?
So I continue to work with all the universities in the province, including St. FX. So a couple of months ago, I gave a very high level, approval to a broad document which laid out the parameters for which each university would then need to follow for a reopening plan. We're now in the process. I'm working with colleagues in the Department of Labor and Advanced Education, so they are in the process of collecting individual post-secondary institution plans, doing an initial review. Those will then come to me for a review from a public health perspective. I've indicated to the universities that one of the key things that I will be looking for is how do they plan to manage international students especially, but also students coming from other parts of the country if necessary, allow them to come here with appropriate safety steps. So that's a point of ongoing discussion with those universities, and we clearly need to make sure that as we necessarily bring students to our post-secondary institutions, but we're putting the appropriate safety steps in place. So I have a call next week with the university president, so we continue to work with them on the issues such as the one you've raised.
Lois Ann, do you have a follow-up?
Yes. When do you expect those plans to be finalized, and when will they be issued to the student body?
My last discussion with my colleagues in Labor and Advanced Education, they were they had a number of plans. I said if you can collect all the plans, and I'd like to look at all the plans together. I think they're working to try to get as many as possible, so I can review them next week before I talk to the presidents. Communication with students, that's the responsibility of the university once we've got a finalized plan.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, a question for the Premier. I understand, as I recall, as we were working after the mass murders, you repeatedly said you needed the federal government involved because the RCMP was questioned, and so it's taken us 3 months to get the review panel, and I guess people will argue over that. But my question to you is, it's been over 12 months since we've learned about not just questions, but real credible accusations about RCMP and Halifax police destroying evidence in the Glen Assoon case. How come we haven't gotten to a review panel there or inquiry? Is it just because Glen Assoon is alive?
No, first of all, the first part of your question wasn't just the RCMP, border service agencies, firearms, all of which fall under the federal government. Needed them to be at the table when it comes to what happened here on the 18th and 19th. My understanding is with the other case you're referring to, that has been ongoing back and forth with a lawyer for Mr. Assoon and as well as Department of Justice, both provincially and federally, to find a resolution.
Tim, go ahead with your follow-up.
I guess I'll ask Dr. Strang just a technical question. There's as COVID was happening, there were difficulties sourcing medical masks, and a great deal of effort went into making sure that supply was secure for healthcare workers. Places in the U.S. Experiencing the second wave are also now experiencing new problems sourcing those medical masks. Do you see any potential problem here in Nova Scotia coming into the fall on that front?
So there's a whole group of people. I'm not directly involved, but I'm aware of their work that is looking at this. Very early on, as in the first wave, we put a group of people together around both the short-term and long-term procurement. So we built a substantive stockpile of both medical and non-medical masks and other personal protective equipment. Right now, they're in the process of doing some work around anticipating what might be the healthcare demands with a resurgence of COVID-19 and building our supplies of masks and other personal protective equipment based on those modeling estimates.
And that's all the time that we have for questions today.
Thank you, Chrissy. Dr. Strang and I, as you can see, sitting in front of you, are not wearing masks today, but we do so when we enter into public spaces, a store, a shopping mall, entering a restaurant. Before we sit down, we wear a mask. And I'm always trying to remind myself to carry it with me as part of a normal routine now. Wearing a mask in most indoor public spaces has to become part of our daily routine. It's the added protection that we are going to require as we open ourselves up to the rest of the country. And opening up to the rest of the country is something we're going to have to do. We need to learn to live with COVID until there is a vaccine. We can't stay closed forever. Our families need to reunite, and our economy needs to ignite. Our tourism industry is worth $2 billion, but it's taken a major hit because of COVID. And I'm afraid if we don't safely open up to the rest of Canada, most of our tourism businesses will have to shut down. And they employ thousands of Nova Scotians across this province. And we can't afford to lose the tourism industry. And I'm worried. If we don't start opening up, visitors will just stop coming. So we need to find the courage to welcome our fellow Canadians. This will not be easy, but none of this has been easy. Think of what life was like 4 months ago. We were completely shut down and locked in our homes. Look how far we've come. This has been emotional and exhausting and hard on so many families, but we flattened the curve because we're willing to do the hard work. When we open up to the rest of Canada, it's going to take some more hard work. That's why we are making masks mandatory for indoor public spaces. That's why we're asking you to keep following the public health protocols. And it's why I'm asking all of you to continue to be kind to each other, including those who come to visit our beautiful province. We are always stronger together.